Hello everyone, greetings to all the viewers. Thank you for choosing Studental online platform for learning. My name is Dr. Atif Nathani. I am an endodontist and I will be taking the topic which is diagnostic tests for pulp vitality. Now before we start with the seminar, I would like to ask you one question, which is, when you see a person in front of you is fainted, what would you do? You would probably lie down the person, ask the person. If the person doesn't respond, you will not just declare them dead, right? You will do whatever is needed to be done to revive the person, to at least understand what's wrong with them, or to call for help. Am I right or wrong? In the same way, when a person will step inside your dental clinic with the pain, you cannot just give them the option of root canal treatment directly or extraction. And what is going on in these days is implant. You cannot just directly jump onto the conclusion. We need to properly evaluate why the pain is occurring. This comes under diagnosis, and one of the diagnostic means is the pulp vitality tests. And diagnosis in general is divided into subjective diagnosis and the objective diagnosis. Subjective is the one what the patient tells you. Those are the subjective symptoms that the patient will tell you that the patient is suffering from. Objective symptoms are the symptoms which are induced by the operator to create the same chief complaint for diagnosis purposes. Out of these tests, one of the tests is diagnostic test for pulp vitality. Obviously, we will have to know whether the pulp is vital or not. Why do we need to know this? Because if the pulp is vital, we can formulate a treatment plan according to the vitality. If we don't know whether the pulp is vital or non-vital, we will not be able to give a proper treatment plan. Now this diagnostic test for pulp vitality therefore is divided into two things. One is the nerve test and the other one is the vascular supply test. Now guys, I'll tell you, vascular supply tests are not available clinically. Practically, it is unavailable and impossible for anybody to test the vascular supply for a pulp. That is why we depend on the nerve tests, the nerve supply. We will tell you in detail. Nerve tests can be divided into thermal and electric pulp testing. Now, thermal test is again divided into cold test or heat test. Vascular supply tests are various tests that you need to just look at it and just write it down. If this question comes for a 5 mark, at least you'll have to write down, enumerate the vascular supply tests, but you will have to explain the nerve tests in detail, everything that I'm going to tell you in the next slides. Now let us begin with the nerve test. The first question that comes in your head is why? Why do we do the nerve test and how does it work? I'll tell you in small sense. The first thing that the patient will tell you is pain. The pain is the only chief complaint that the patient will come to you with. When you ask the question, where exactly are you feeling pain? The patient will vaguely tell you lower jaw, upper jaw, anterior, lower anterior, upper anterior. There are very few patients who will tell you exact specific tooth that is paining. I'll tell you the reason for that as well. After that, if you ask the question, any specific tooth, obviously the patient will tell you, don't know doctor. In such cases, what will you do? You have to have that understanding in your head that there are A fibers and there are C fibers. A fibers are divided into A alpha, A beta, A gamma and A delta. The C fibers we all know is known as pulp proper. Why do we say this? Why people have given these names to C fibers and A fibers? We'll tell you why. A fiber comprises of 10% of the total A fiber, and A delta comprises of the 90% of A fibers. Now, A beta fiber is responsible for pressure and touch because these are proprioceptive fibers. That means these are the fibers which are responsible for the patient or for you or for me to understand where and which tooth exactly is paining. That is why if you have good A beta fibers, you'll be able to pinpoint the location of the tooth that is paining. A delta, on the other hand, is only capable of sending one and only one pain stimulation towards the CNS. The only response that A delta will send is the pain stimulus. Now these A fibers are at the periphery. These are like the soldiers which are guarding the kingdom. Alright? Whatever comes will come and hit the A fiber first, and then it will go towards the pulp proper. That is why it is known as pulp proper. Pulp proper, which is the C fibers. C fibers are like king. These are inside a protective mechanism, inside a protective wall which is formed with the help of A fibers. That is why whatever thing, whatever stimulation, whatever response that will be there in front of you by the patient, that will be from the A fibers and not from the C fibers directly. When the A fibers do not respond, and if the A fibers get necrosed or they die, then only the C fibers will come into play. Now A fibers are myelinated fibers, that's why they have the conduction like super fast conduction. C fibers are unmyelinated fibers, that's why they have very slow conduction. And the A fibers, which are myelinated fibers, have the capability of sending sharp, shooting and piercing pain. On the other hand, the C fibers will give you dull, aching pain. Now let us see which test will trigger which fiber. The electric pulp test and the cold test will trigger the A fibers, and the heat test, and only the heat test, will trigger the C fibers. If the cold test and electric pulp test, the response is a good response, and if the tooth is responding, that means the A fibers are responding, that means the soldiers are still alive. That means the pulp inside the tooth might be viable and might be in a reversible state. If at all these fibers or these tests do not give you any kind of indication or any response, then you have to jump onto the heat test. When you are done with the heat test, then you will get to know whether the tooth, whether the pulp is non-vital or not, or is in a reversible state or not. Let us begin with the electric pulp test. The electric pulp test, it doesn't mean that you are trying to pass proper electricity through the body of the patient or through the body of the tooth. No. It is just an electrical stimulation that we need to pass towards the A fibers, towards the pulp, so that we get a warm, tingling, burning sensation, or for that matter, painful sensation. Nerves that, we have already discussed this, but I'll again repeat it. Nerves that respond to EPT are A delta fibers, which are nociceptors and can only and only transmit one sensation to the CNS, and that is pain. Now when you are doing the electric pulp test, the first thing is you need to do the electric pulp testing on a contralateral tooth. Record the reading when the patient feels warm, tingling or painful sensation, and read it as the controlled reading. Then you have to repeat it on the concerned tooth. Once you are done with this, then you need to proceed with the evaluation. Before that, let me tell you the technique that is used to do the electric pulp test. This is by Grossman. Now first and foremost thing is you need to describe the test to the patient in a way that the patient will have less anxiety. because this will obviously affect your result. So that is why you need to explain the patient. The patient should not be in an anxious state. So this will eliminate a biased response. After that, isolate the area of the teeth to be tested with cotton rolls, with saliva ejectors, with rubber dam, whatever you want you can, and then air dry all the teeth. Check the EPD for function and determine that current is passing through the electrode or not. Do not touch it on your tongue and try to evaluate it. There are ways in which you can do it. So you'll have to read the manual once you buy it. Apply an electrolyte like toothpaste on the tooth electrode and place it against the dried enamel of the crown's occlusobuccal aspect or incisobuccal surface. Once you're done with this, keep this in mind that you have to avoid contact with any restoration adjacent gingival tissue with the electrolyte or electrode, which causes a false response. We don't want false negative, false positive responses from the EPT. That is why you need to be careful. Retract the patient's cheek away from the tooth electrode with the free hand, which will complete the electrical circuit. Turn the rheostat slowly to introduce minimal current very slowly. I'm writing it down slowly twice because the current has to be applied very slowly. It has to start very slowly. Ask the patient to indicate when the sensation occurs by raising hand and not by shouting or like trying to talk, and letting us know by using words such as tingling or warmth or pain, and record this result according to the numeric scale on the EPT, and repeat this test at least 2 to 3 times so that you can eliminate the false readings. So once you are done with the control tooth reading, that has to be a normal reading. You have to consider it as a normal control tooth response. If your affected tooth responses in the same way, that means there is nothing wrong. Now there are 3 other responses: the normal responses, the early response, delayed response, and the normal no response. Early response means less threshold is required for the same amount of pain to be induced in the affected tooth. That might indicate diseased state. If there is more threshold required for the same amount of pain that is to be induced, that was induced in the control tooth, in the same way in the affected tooth, that means it's an indication towards a diseased state. If there is no response even after higher threshold of the electric pulp tester, then you can say that there is no response, or might be the pulp is dead. You need to correlate it with the other tests. And there are 2 responses apart from these responses, which is a false positive response. First of all, let me tell you where you can get false positive responses. In partial necrosis or in gangrenous necrosis of the pulp, you'll get a false positive where the pulp is dead completely, but the electric pulp test will give you a false positive response as if the pulp is still alive. Next is the false negative response. The false negative response might be due to extensive calcification, fibrotic pulp, sedation, medication that is being taken by the patient, extensive restorations with a base, high pain threshold, recently erupted tooth, and recently traumatized tooth. In such cases, the EPT will tell you that the pulp is dead, but the pulp is not dead, but the pulp is still responding, but because of all these factors there is a false negative response. That is why you need to repeat the test 2 to 3 times at least. Let's move ahead. Apart from this, false positive responses can be seen when the electrode are in contact with a restoration, that is a full crown, amalgam, or a full metal crown, or full restoration that is there, or if there is some kind of a link between the gingiva and the electric pulp testing that will allow the current to reach the attachment apparatus, that will give you a false positive response. Now there is patient anxiety as well, which will give you false positive response. Failure to isolate and dry the teeth properly. Multi-rooted teeth, this is one of the reasons where we get confused. Multi-rooted teeth, if there is partial necrosis and partially the teeth is still alive, the pulp is still alive, the electric pulp test might get a false positive reading, and you might get to a diagnosis where you might say that the pulp is still alive, wherein the pulp is completely dead from inside. The false negative responses we have all seen, but there is one important response that you need to keep in mind that might be there, because of which you can get a false negative response everywhere. It is because if the batteries are dead in your pulp tester, the pulp tester is not turned on, the pulp tester device is non-functional. So these are hilarious things, but these things happen to all the clinicians sometime or the other. This thing happens. You need to keep in mind that this might be one of the reasons for a false negative reading. Now, advantages of electric pulp testing. The advantages are intensity of stimulus is comfortable to the patients. The digital display of many EPT provides easy and reliable information. In some EPT, a red indicator light flashes on and off when there is maximum stimulation reached. So you need to keep that in mind, which is a good indication. And advantages is that it gives a quantitative reading and can be compared with a normal reading on a control tooth as well. Now, disadvantages, you need to know these, you need to write it down as well when you are talking about the theory paper. It gives no indication of the state of the vascular supply, which would give a more reliable measure of the pulp vitality. It cannot be used in patients with cardiac pacemaker because of potential interface with the pacemaker. It's technique sensitive. You need to be very sensitive, and you need to be very careful while using your electric pulp tester. False responses, which can be positive or negative in some cases, as listed above. You can go through it. It cannot be used on teeth with full coverage restoration because an electric current, obviously an electric stimulus, cannot pass undistorted through acrylic, ceramic, metal portions of the crowns, metallic portions of the crowns, amalgam. So you need to be careful when you are dealing with such kind of full coverage restoration. Electric pulp test will not work. Now, some commercially available EPT. Why I'm telling you this? Because if you write it down in your papers, or if you want to buy these things, you need to keep in mind that these are the few commercially available papers. If you write it down in your papers, guys, that will be an additional information that we will be providing, and the evaluator will be really happy if you at least write 2 names or 3 names. So if you can, you should. I would prefer you should write it down. Now let's come back to the nerve test. Now we are done with the electric pulp testing. Now we'll move on to the thermal test. So I'll tell you in general about the thermal test first, and then later on I'll tell you about the cold testing and the heat test. Now, thermal test. This is one of the most important tests. It deals with the vasodilation, because thermal, in general, hot will give you vasodilation and cold will give you vasoconstriction. So you have to keep that in mind, and you have to write it down. One of the most common symptoms associated with inflamed pulp is pain induced or relieved by hot or cold stimulation. Whenever a patient comes to your clinic, he will just tell you that the pain starts when they eat or drink something which is very hot, and immediately subsides because they consume something which is very cold. This is an explanation to vasodilation and vasoconstriction, which is caused by hot and cold stuff respectively. The heat causes vasodilation, which causes the pulp to expand, obviously, and in an enclosed cavity the pulp cannot expand too much. So if you are trying to stimulate the pulp with the help of hot stuff and it's trying to expand and it's unable to do it, it will cause pain. And the minute you have a cold stuff, which will cause vasoconstriction, which will try to bring back the pulp to its normal constricted way, this will relieve the pain. This is why the patient's chief complaint would be this. Immediately, if the pain decreases and does not linger for a long time, that may be an indication that the pulp is still in a reversible state and not passed on to the irreversible state. Now let's deal with the technique. In general, the thermal test is to be done like this. The first, you need to explain the patient about the diagnostic procedure, isolate the tooth along with the contralateral tooth. Obviously, you'll have to do it on the control tooth first, and then you have to do it to the affected tooth. Check the response of the normal tooth first and then repeat the same on the involved tooth. Ask the patient to raise their hand as soon as they feel any kind of sensation, which could be heat or could be pain. Heat or cold tests are performed is performed by placing the stimula in the middle third of the labial surface of anterior tooth and the middle third of the buccal surface of the posterior tooth. Now we'll talk about the cold test first. I'll tell you what all can be used for the cold testing. You can make and you can prepare ice sticks. You can get it commercially as well, and you can get ethyl chloride, ice water bath. You can get endo ice. I would prefer endo ice, which is like the best possible way to do a cold test. And then there is a DDM, which is difluoramine. This will obviously give you an idea, but the endo ice is to be preferred clinically. Even if you are writing down in your papers, you need to describe all these devices or things that can be used for doing cold tests, and the preferable technique for using for doing cold tests is by using endo ice. The endo ice comes in a bottle like this. You'll have to write it down. You cannot draw it in your papers. But for cold tests, tooth must remain dry and isolated. Now, after you are ready with the isolation and you're done with the drying and isolating the tooth, you need to spray endo ice on a small cotton pellet, apply on the normal tooth to get the controlled response first, then apply on the other cotton pellet and then onto the affected tooth. This is how you record the cold test, and you need to evaluate how the normal tooth responded and how the affected tooth responded. If the affected tooth is responding in the same way as the normal tooth, the control tooth, that means the pulp inside the affected tooth is still in a normal, healthy state. If there is sharp shooting pain which disappears immediately after the stimulus, this is an indication that the pulp is in a reversible pulpitis state. If there is excruciating pain which lingers after the removal of stimulus as well, that's an indication where you can say that the pulp is in an irreversible pulpitis stage. If there is no pain at all, that means that's an indication towards non-vital tooth. You cannot just take one test, do it, and then say that the tooth is in non-vital state or an irreversible state or in a reversible state. You need to confirm it with other tests as well. Let us proceed now towards the heat test. Again, I'll tell you different types of materials and techniques that can be used to do the heat test. You can use hot GP, you can use electrical heat carriers, you can use heated burnishers, ball burnishers, you can use hot compound, dry rubber polishing wheels, and hot water, which is like coffee hot water. Alright. After this, the heat test. Again, this is the test which is in which we are trying to evaluate the response of the C fibers and not the A fibers. The heat test will tell you the effect that is there on the C fibers, which is the pulp proper. If the response is normal, exactly similar to the control tooth, that means the affected tooth has normal, healthy pulp. If there is immediate excruciating painful response which is markedly different from the control tooth and lingers after removal of the stimulus for more than 2 minutes, 3 minutes, 5 minutes, the patient still has pain, that's an indication of irreversible pulpitis. If there is no response at all, if nothing, the patient feels nothing, you confirm with other tests because this might be an indication towards non-vital tooth. Let's proceed and tell you about the accuracy. Now, why accuracy is important? Because we need to know whether to believe on one test or the other test or all the tests, because there is no such particular test which is 100% accurate. That's why you need to do the diagnostic tests for all the things, for endo, for vital pulp, non-vital pulp, irreversible state, reversible state. That's why we need to do all these tests, and we need to know the accuracy. You need to write it down in your papers as well. EPD, it is like 80%, 81% accurate. It tests the nerves. After this, if you are not done with the if the EPT is done, you need to go to the cold test. You cannot jump onto the heat test directly. You need to do the cold testing, which is 86% accurate. Now, these two tests will differentiate between reversible and irreversible pulpitis, and after this, you can go towards the heat test. This will identify irreversible pulpitis and use it to replicate the chief complaint. This will give you a 71% accuracy. You need to keep this in mind. All the tests that you do and that you try to replicate have limitations. Similarly, these tests also have limitations, which is lack of correlation with the histological condition of the pulp. Obviously, you cannot go to the histological state first and then go back to the clinical state, so there is no correlation between these two. There is lack of objectivity. Reproducibility means you cannot reproduce it again and again and again. Once done, it's done. You have to just wait for the pulp to get back to normal, body to get back to normal, and then again and try to get the same result from these tests. So there is lack of reproducibility. Unpleasant sensation, effect of maturation state of the tooth. If the tooth is in an immature state, if the apex is still in the formation of it, the apex is not formed completely, it's still in the process of its completion, and you're trying to do a heat test, pulp test, nerve vitality test, diagnosis, right? You might not be able to get the real sensations of the pulp. That is why this is a limitation. The effect of trauma, always remember, the effect of trauma is like when you get a trauma to a tooth, the tooth is in a stunned position, the pulp is in a stunned position. It's contusion, concussion, which is felt by the tooth. The tooth will not respond to your vitality test. So whenever there is a patient or there is a case which will come to you, saying that there is a trauma, do not try to do a root canal treatment or try to extract it or do any kind of pulp vitality test, because it will not work. It will give you a false negative or a false positive response, which is not indicated. So that is one of the limitations, that it will not work when there is trauma. Then there is effect of drugs, age influence, effect of periodontal diseases, and false results. These are all the limitations that are there for the vitality tests. Okay, apart from all these tests, the nerve tests, there are additional tests that can be used to evaluate the vitality of the pulp. These are selective anesthesia, biting test, and test cavity. Let us begin with the selective anesthesia first. Now, in the uncommon circumstance of diffuse strong pain of vague origin, when the patient is unable to relax and is not able to come back to its normal state, this is the test that can be used. Selective infiltration or intraligamentary anesthesia can be employed to help identify the source of pain. The basis of this test lies in the fact that pulpal pain, even when it is referred, invariably is unilateral and stems from one branch of the trigeminal nerve. So if the patient tells you that there is pain on the lower aspect or the upper aspect or on the auricular area, you need to use this test. You can use this test. If you are unable to get it, you need to block it. I'll tell you the technique in the further slides. Now, technique of this test is using either infiltration or the interligamentary injection, and inject it to the most posterior tooth in the area which is being suspected. If the pain persists, anesthetize the next tooth mesial to it and continue doing this until pain disappears. Now the question arises, what if the pain doesn't disappear? If the pain doesn't disappear, you need to administer inferior alveolar nerve block. If you block the inferior alveolar nerve completely and the pain diminishes, that means the area of concern is in the mandible. If the pain doesn't go away, that means the mandible is not responsible for the referred pain. That means you need to focus on the maxilla. Next is the biting test. This test helps if the patient comes with a complaint of pain during mastication. Patient feels pain. There are two reasons where this thing happens. If there is pulpal necrosis and has reached to the pedial space or the periapical area, or if there is vertical fracture in the tooth. Biting test will be very easy and very helpful in these two situations. Let us see the technique. Ask the patient to bite on a hard object, for example like cotton roll, a tooth sleuth, a board stake, rubber wheel, or a burlo rubber disc on the suspected tooth and the tooth on the opposite arch, so that they'll get the response. There are two outcomes: pain while biting and pain while releasing. So if there is pain while biting, this is an indication that there is periapical infection. If there is pain while releasing, this is an indication of a fractured tooth. This is how you do it, and this is the tooth sleuth. Just a small example: if there is a lower molar with this red mark, it's an indication that there is periapical lesion and the patient comes to you, and when you put a cotton roll in between the tooth and you try to press it, that thing will hurt. If on pressing it hurts, that means there is periapical infection and no fracture, and if there is, if vice versa happens, that means there is fracture. Now we're done with the biting test. Now we'll talk about the test cavity. Now first I'll introduce you to test cavity's technique. The test cavity involves slow removal of the tooth structure to determine pulp vitality. This cavity is prepared with a small round burr at slow speed without a coolant. Test cavity is made by drilling through enameller dentine junction of an unanesthetized tooth. Keep this in mind, unanesthetized tooth, you need to go till that junction. If patient experiences pain, then proceed to, if patient doesn't experience pain, then you have to proceed towards the pulp chamber. This is an indication that the pulp is dead. That is why there is no response, no pain, no sensation while drilling. So you need to wait. As soon as you hit the enameller dentine junction, then you need to proceed towards the pulp, and you need to then carry on with your root canal treatment. Now this test is carried out only when other means have failed. Therefore, disadvantage of this test is iatrogenic damage to all the teeth that you are trying to evaluate. So keep this in mind and keep this in your head. Pain or sensation felt by the patient indicates vital pulp, and thus test is performed on other teeth until the involved tooth is found. Alright, so to summarize everything, diagnostic tests for pulp vitality, nerve test and vascular supply test. Nerve test can be divided into thermal test and electric pulp test. Thermal test is again divided into cold test, heat test, and then you need to enumerate at least the names of these vascular supply tests, which are not clinically available and practically possible, but you need to write it down, at least enumerate them, and then you need to explain in short additional tests, which are selective anesthesia, biting test, and test cavity. When you're writing on a paper, I would suggest you need to, if you can draw a well-labeled diagram like this, you can just give explanation on what all you are going to explain in your paper. You need to explain this in detail, you need to explain the additional tests in detail, and if this is a 5-mark question, you need to at least write down and enumerate these vascular supply tests. After this, each and every test should be described properly, the technique should be described. If you can, you should draw a well-labeled diagram to describe them, write the advantages, disadvantages, limitations, and a small summary to summarize your question. Thank you so much. Thank you guys, thank you for listening to me, and thank you for I hope it will be helpful, and it was helpful for you guys to understand the diagnostic techniques that are used for pulp vitality. Thank you. Take care.